Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM Institutes. Again, we assure you for the best sample answers when it comes to OET. Having a decade of experience, it's almost 10 years down the line we are here, and one of the most experienced institutes when it comes to OET teaching. We assure you for the best services. First of all, always start your task from behind. Always. Use the information, write a letter about Rosie to the community nurse at Elizabeth City Community Health Center. So you have to write the data. You have to write the letter to community nurse. This letter is very simple. If something like this comes in the exam, which is a simple discharge letter, I would be extremely happy. But the problem is data. So much of data. See, this is one page. And this is the second page. So obviously, if I write everything, my exam is gone. So please understand how to select the data. So this letter is all about how to select. So the first thing I realized is I have to write the letter to community nurse. Community nurses are the nurses who take care of the additional aspects apart from the medical aspects. So let's see. I have always said, जब भी discharge letter होता है, जब भी visit letter होता है, तो today की visit is the purpose. Main today visit. When there are discharge letter, discharge plans are the purpose. So this is the purpose of today's letter. So I will try to write it in the points just as to make it comfortable so that I can understand what points I have to cover. So discharge plan is the main purpose. First, follow-up visit for medication monitoring and management. So that means medication monitoring and management of the medications is the first point. RE means regarding. Regarding means about. So that means guidance about the installation of asthma action plan at school and sporting club. So second is the guidance of asthma plan in school and sport club. So this will decide my data at the end of the day. That means from the first point, I realize that maybe she is very young to take the medications by herself, or she is not interested to take the medications. That's why it is important to visit her, to pay a follow-up visit. Follow-up visit means that community nurse will go at her home and will pay a follow-up visit and will monitor the medications and will manage. She will also give the guidance regarding the asthma action plan. So she will talk to school and she will talk to sporting club that you should have an asthma plan because this girl is now prone to asthma attack. So it can happen in the school. So please be prepared. So that is what is the function, what is the purpose, what is the job responsibilities of the community. So she will go to school and she will talk to the management. Third, encourage father to smoke outside. That means father smoking is one of the points that is necessary to be taken from the social history. It's very important. Her father is a smoker. Fourth, Cambodian interpreter. That means this family is basically from Cambodia and they do not understand English. That is why they need an interpreter. So that means this is how I select my data. If I have any chance to drop the word count, this is my hint. This is my clue to decrease the data. ये मेरे पास clue है. मुझे सिर्फ ये 4 points cover करने हैं. These are the only 4 points which I need to cover. So my discharge plan is ready. My material is ready. Everything is ready. I would go to my. So you just read the last. आपको पर्पस समझ आ गया है कि कम्युनिटी नर्स को फॉलोअप विजिट करनी है मेडिकेशन के लिए. स्कूल और स्पोर्टिंग क्लब को कहना है कि आप एजमा एक्शन को तैयार रखो, इस बच्चे को प्रॉब्लम हो सकती है. बच्चे को लोअर इम्पैक्ट एक्टिविटीज करनी है, इसकी डिस्कशन करनी है. फादर को कहना है प्लीज आप बाहर जाके स्मोक करो, घर में मत करो. और कंबोडियन इंटरप्रेटर चाहिए होगा इस मीटिंग के टाइम. दैट्स इट. तो शी विल अरेंज अ कंबोडियन इंटरप्रेटर. तो लास्ट पैराग्राफ इज ऑल सेट टू गो. वैसे अगर आप चाहते हो मैं लास्ट पैराग्राफ यहीं लिख दूं, शायद थोड़ा आसान रहेगा, मैं लिख ही देता हूँ आपके लिए, इजी रहेगा। लास्ट पैराग्राफ कैसे लिखते हैं, सॉरी मैं पहले लास्ट पैराग्राफ लिख रहा हूँ, पर इससे आपको पर्पस आपको अच्छे से समझ आ जाएगा कि पर्पस क्या होता है, और आपको डिस्चार्ज प्लान लिखना भी आ जाएगा। सो लास्ट हमेशा शुरू करते हैं, इट वुड बी ग्रेटली अप्रिशिएटेड if you could pay a follow-up visit at her home। एट हर होम नहीं लिखा तो हम भी नहीं लिखेंगे, रिस्क नहीं लेना, नहीं दिया तो हम भी। इफ यू कुड पे अ फॉलो अप विजिट फॉर मॉनिटरिंग ऑफ मेडिकेशंस एंड मैनेजमेंट, दैट्स इट, सेम वर्ड, नथिंग डिफिकल्ट। सेकंड पॉइंट, गाइडेंस रिगार्डिंग इंस्टॉलेशन ऑफ एस्मा एक्शन प्लान। फर्दर या फिर काइंडली, सिंपल लिखते हैं, काइंडली गाइड, फर्स्ट फॉर्म बना दिया, गाइड स्कूल, अगेन मेक इट वेरी सिंपल, काइंडली गाइड स्कूल एंड स्पोर्टिंग क्लब। अब इसको जो आगे वर्ड्स थे उनको पीछे ले गए, रिगार्डिंग इंस्टॉलेशन ऑफ एस्मा एक्शन प्लान। देखिए हाउ सिंपल यू कैन मेक इट, लुक एट दिस, हाउ सिंपल। Full stop. Further discussion, first write this thing, discussion should be conducted। डिस्कशन को हमेशा कंडक्ट किया जाता है। पैसिव वॉइस बना दिया, फर्स्ट आपने इट वुड बी ग्रेटली अप्रिशिएटेड बनाया, सेकंड आपने काइंडली बनाया, imperative sentence, then you go to further discussion should be conducted same regarding lower impact activities and swimming is recommended, same line। third line is complete। fourth, it is important, make it very simple। now you have made passive voice and everything, so go, it is very important to arrange a Cambodian interpreter for this meeting। simple likh do na, why to attend this meeting, for this meeting, simple, it is important to arrange a Cambodian interpreter for this meeting, simple, you have ended it so well। her father is a smoker, so I will say please note, otherwise I will say it is important to be noted, but I have already used important, so I don't want to use it again, please note। so I will not write it in social history to save the data। father is a smoker, so he needs to be encouraged, again a passive voice, needs to be encouraged, should be encouraged or needs to be encouraged to smoke outside। my last paragraph or the main paragraph is all set to go, so please when you listen to this video, pause it and understand how easy you can make it for yourself and can pass OET। so these are all the services that would be provided by the community nurse। now after understanding last paragraph or purpose, I go to first page। now I would like to understand the patient। so Lyle McMahon Hospital, Rosy Vy, that is the name of the girl, 1996, she is born, admission date is 7, so 7 minus 96, that means she is around 11 years old। I can understand, now I can understand, obviously she is a school going girl, it becomes easy। she was admitted in our hospital for 2 days, severe asthma attack, due to severe asthma attack। this is the story, understand story of the letter, then it will be, OET will become very simple for you। severe asthma attack, so she was admitted to our hospital, her PFR was 140 degree at the time of admission, 140 liter per minute। in medical history I was like, she was diagnosed with asthma 2 years ago, but since last 6 months her attacks have been more severe, this is her second hospitalization in 3 months। but again, if you will realize this data, of course according to the topic this is very important, but this data is not mandatory, but it is still, I would say, not to miss out, because it tells the community nurse that now the attacks are becoming severe and they are frequent. So that means that it can happen again in school. So I would like to consider this data. If by chance I forget, not a problem. But this is very important. This is important. So medications, I would simply say she was diagnosed with asthma and she is on medications. Community nurse do not require medications, does not require medications. So I will save this data. Frequent bronchitis, not required. This letter is all about asthma, because again, you will say, sir, bronchitis is also related to lungs. It's important. I would say that community nurse has to make arrangements only for asthma. She is not related to bronchitis. She doesn't have to worry about it. But again, if you consider everything is important, then it will become impossible. So sorry, I have to delete this data. So this is out. Now comes to social history. Lives with parents and 2 younger siblings. I don't need it. Lives with parents. Yes. Attends school. Yes. And an active sports player. Yes. Because that is why it's happening. Because in the later stages, I have to tell not to play sports which require intensive activities. Does not take medication to school or sports game. This is important. That is why it is important to monitor medications. Parents have poor level of English and do not understand implications of daughter asthma. Patient came from Cambodia 12 years ago. So this is not kind of very important. Otherwise, I can decrease this data and can simply say parents are basically, families basically from Cambodia. That is the only thing I need to write. I can write it in the last as well, because they are basically, but again, it is better to write over here. Then no immediate family in Australia not required. Father smokes, I have written in the last paragraph. So I don't need it. So over here, what I am considering is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and this is not required. So these are the things I am considering. From the, that is how I will save my data. Then going to the next page. Okay. Sorry. Yeah. Admitted with severe difficulties with the use of accessory muscles, distress, this and this, all this is not required. So you can simply say during hospitalization, because she stayed in the hospital for 2 days. So you simply say, third paragraph, I am writing for you. Fourth, I have already written. Third, I am writing for you. So during hospitalization, I'm just teaching you this thing, just how to stop, how to prevent the excess of words, how to reduce the word count during hospitalization. Yeah, over here best is at the time of admission. This is the best. She had severe breathing difficulties. However, after treatment, her condition got improved. That's it. Anything important? Continuous buffer for medication. Medication was reduced to nothing. Asthma action plan. Her condition got improved. Also, yeah, later that means after the improvement of the condition, simply we can say her mother, she and her mother, she along with her mother, या the patient लिख देते हैं, क्योंकि I'm just trying to find the right word. So I will read it for fluency. The patient along with her mother was encouraged, was educated, sorry, regarding asthma action plan and PEFR monitoring with the help of translator. That is the main line. That is what social worker would like to know. Now I will try to read the last two paragraphs which I have created, and that is how you will save the data. So let's see what I have created and what additions I can do to make it better. So first I will try to write as less as I can. At the time of admission, she had severe breathing difficulties. However, after treatment, her condition got improved. The patient, along with her mother, was educated regarding the. So I can say over here at the time of admission, she has also during hospitalization. I can say this word will really help me, which I did not use in the start. The patient along with her. Now it's looking perfect. At the time of admission, she had severe breathing. However, after the treatment, her condition got better, got improved. During hospitalization, the patient, along with her mother, was educated regarding the asthma and PFR monitoring with the help of translator. After discharge, after discharge, this will suit this line. After discharge, it would be greatly appreciated if you could pay a follow-up visit. Now it's perfect. Sounds like a good line. At the time of admission, she had severe breathing difficulties. However, after treatment, her condition got improved. During hospitalization, the patient, along with her mother, was educated regarding the asthma action plan. After discharge, it would be greatly appreciated if you could pay a follow-up visit for the monitoring of medications and management. Kindly guide school and regarding the asthma action plan. Now, one thing can be done if you will understand that this particular, I'm just going to take it to a better page. Sorry, it's just about teaching. I know I'm teaching slowly, but it is important for you to learn. Again, if we will have the patience, we will learn more. Even I want to teach fast. I want to wrap it up because I already know it. So it's just about making it better. I want to take this point later. If I can take this point from here, and the first point, if I can make, it would be greatly appreciated if you could guide school and sporting club regarding the installation of asthma action plan. Discussion should be conducted regarding this and this thing. It is important to arrange a Cambodia interpreter. Means I want to say you can put asthma action plan वाला line आप पहले लिख सकते हो. इसको पहले लिख सकते हो आप, क्योंकि ये मेन टॉपिक है. और इस वाले पॉइंट को आप सेकंड नंबर पे लिख सकते हो कि if you could pay a follow-up visit for the medications. So that is how you can decrease the word count. And if I talk about the first paragraph, then it is even simple. First, इसके बाद मैं आपके डाउट्स भी लूंगा. फर्स्ट पैराग्राफ अब सिंपल हो गया. देखिए फर्स्ट पैराग्राफ, दिस लेटर is being written. Now the story will automatically become regarding Miss first name Miss Rosy, who was admitted. Again, it is just about story. The first paragraph purpose due to severe asthma attack with the help of treatment. She is better and is ready to be discharged. Simple. Again, you can make your own lines and can tell the story, and is ready to be discharged. However, she and her family need assistance in executing asthma action plan, need assistance or need education as well as assistance in executing asthma action plan. So it is so they are being referred to you. That sounds perfect. Now it becomes very simple. This letter is being written regarding Mrs. Rosy Vy, who was admitted due to severe asthma attack. That's it. With the help of the treatment, she is better and is ready to be discharged. However, she and her family, this is where grammar comes into action. Plural, need, not needs. No, no. She and her family need education as well as assistance in executing asthma action plan. So they are being referred to you, or you can say, so the family is being referred to you. That's it. Then Miss Rosy, second paragraph is about this. This I can write very easily according to the discharge. Miss Rosy is a school going student and is active in sports. So you can merge up the lines. Active in sports. Her family was active in sports. She was diagnosed with asthma. Again, you can write simply. Again, I'm not using any connectors. I don't need connectors. It's simple. It's going in a flow. Rosy is a school and she is active in sports. She was diagnosed with asthma 2 years ago. Why to use connector jabardasti? That is what OET is saying. Don't use connector jabardasti. Don't do any kind of push or compulsion. It is not a compulsion. She was diagnosed with asthma to this, for which use right connector, for which she is on medications. Now see the flow of the letter. However, she does not take medications. That is how what is natural writing. She doesn't take medications to school or to sporting club. Her family is also unaware about implications of asthma. Natural. Family is basically from Cambodia. And does not speak good English. Now my topic is all good. I think I have not missed out any point whatsoever from my side. If I have missed, I will get to know by matching it with the description. School and sporting club, I have covered. It would be greatly second if you could pay monitoring of medications. I have covered. She does not take medications. Discussion should be conducted regarding asthma action plan. I have covered, and I have covered here as well. Cambodian interpreter, I have covered. Smokers, so he needs to be encouraged. That I have already written down. So my topic is all good to go. And please, again, I would say even listen to it 5 times. This particular paragraph. How to make a story by yourself in a smooth way with no usage of connector at all. School going student and is active in sports. She was diagnosed with asthma 2 years ago, for which she is on medications. Now, however, she does not take medication. So it is coming in a sequence. That is how you can take 450 marks in a sequence. Medication to school. Her family is also unaware. So she doesn't care, even family does not care. The family otherwise, so you can say the family is basically from Cambodia and does not speak good English. At the time of, so that is how you go. So at the time of admission, she had severe difficulties. This is, you are talking about hospitalization. However, after treatment, her condition got improved. During hospitalization, the patient along with were educated regarding the asthma. So because they were not aware, so this line is also matching that we are talking about, that they were educated because they do not care. So they are unaware about the implications. So they were educated and about the PEFR monitoring as well. So if you want to, now what you can add, if you want to add extra points, otherwise word count is good enough and complete. If by chance you want to add, so was admitted due to severe asthma attack and her PEFR was 140 milliliter per whatever has been given. So this you can add. This is the line I would like to add if by chance I want to, because there is thing about PFR over here and later on as well. So I will say PFR was, that means they were totally unknown. So this line I would like to add. Otherwise, one of the lines over here that they were educated, and there was one more line that can come over here that they were educated. No, it's already there. So I don't need anything. So that is how OET letter data selection is there. And now we can, and now you can word count, give it a word count short: 1 2 3 4 5 6 7 8 9 10 11 12 13 14 15 16 17 18. So 1 2 3, almost around 55 words. And in exam, never write your words. Never write your words. Never means never. Please do not do this mistake. Do not write your word count. They will deduct your marks if you will write like this. That means 55 over here, 55 around over here, and almost 60 around here. So even after writing so much, so less, still my word count is around 220 words. So you can well understand. So if you try to write anything more than this, it will shoot up to 250 and you will lose marks. So please understand, it's very bad to lose marks. I hope you all understand. Now I will take your doubts. Please listen to this recording 5 times, 10 times, 20 times. I don't care. I just want you to learn how to do data selection. This is Dr. Bhupesh from Dr. BKM Institute. Our contact number is 76967342256. Thank you.